I would love to hear from both of you, what use cases do you see when it comes to digital mental health and the use of AI? Don, do you
Well,
want to start?
sure. I think that Dr. Niraj's comment about the ability to give precise diagnosis as opposed to what happens today. We look at a constellation of symptoms while you're in our hospital. And generally, there are multiple different individuals opining on your particular condition. And then we try to gather that information together, and it's an imprecise process that we go through to get a diagnosis. While you're in the hospital, we then follow that diagnosis. We provide medication that's particular for that diagnosis. We see how it impacts on you. We titrate, we add, we do a whole variety of different things to adjust your medications. And then we hope to get a progressive improvement over the time you're with us. And the lack of science in that process, one, makes it a very difficult process for the patients to go through because the changes that are made during the process, and our medications have different side effects. They have different immediate effects on our patients. And then secondly, the lack of precision in that process oftentimes leads to a patient leaving us and having to come back in shorter periods of time for adjustments to that medication or adjustments to offset the side effects. So the entire process is too lengthy, too complex right now, and oftentimes leads to significant additional costs and challenges for the families that are working their way through an episode of this. So put that together, we are really desperate for better diagnostic services, more precision in that process to make this an outcome-driven and a cost-effective treatment modality.
Yeah, so as Don mentioned, there is a bit of a trial and error process in this process of doing diagnosis and figuring out what interventions to make. So AI and ML could help in the following way. So the hypothesis is that the condition, the mental health disorder, leaves a signature on the physiological signals that emanate from your body. For example, your skin conductance, skin temperature, could be heart rate, pulse oximetry, could be blood pressure. So there are lots of signals that are emanating from our body that can be caught with these wearable medical sensors that are increasingly getting integrated into smartwatches and smartphones. And the hypothesis is that that signature that the condition leaves on these physiological signals is unique to that particular condition. And it is possible to distinguish one condition from another, in addition to distinguishing that condition from the healthy status. And that's something that we have shown in a framework that we call MHDeep, for Mental Health Deep. DEEP stands for deep learning. We use neural networks to be able to do this diagnosis. And then, as I mentioned earlier, after you've done the diagnosis, and sometimes you have a neural network for depression, another neural network that has been trained for bipolar disorder, and both of them may be saying that this person has this condition. So now you have to distinguish the two. And so there's another neural network that you can use to do the differential diagnosis. So that's something we are trying to incorporate into the workflow, and with Don's help. And I would like to point out that 5 years ago, when we pitched this idea in 2017, I remember it was summer of 2017, my PhD student Hong Shu In and I went over to Career Clinic in Belmead. It's about 8 miles from Princeton University. And we pitched this idea to Don, and Don immediately saw the implication and the application of this in the digital psychiatry workflow. So one of the first people who appreciated this idea, although we've had a lot of pushback on our idea from elsewhere, but Don could see it within a minute that this idea could work. And so now, 5 years later, we are in the process of trying to validate this approach with field trials with the help of Don's organization.
Thank you, Dr. Jha.